In this lesson, we're going to take a closer look at allergic reactions. We'll break down the differences between mild allergic responses and true anaphylaxis and talk about why recognizing these early is so important. We'll walk through how to assess a patient experiencing an allergic reaction, discuss the best treatment options in the field, and review important steps for post-treatment care. By the end of this lesson, you'll have the tools you need to help improve outcomes for patients facing allergic emergencies. Allergic reactions and anaphylaxis are critical medical emergencies that EMS providers must recognize and manage quickly. An allergic reaction occurs when the immune system responds abnormally to a typically harmless substance, while anaphylaxis is a severe, potentially life-threatening reaction that can develop rapidly. Understanding the difference between mild allergic reactions and full-blown anaphylaxis is essential for proper patient care. EMS personnel must be able to recognize early signs and symptoms, which may include hives, swelling, difficulty breathing, wheezing, dizziness, or hypotension. These symptoms can progress quickly, making rapid assessment vital. Administering an EpiPen, epinephrine auto-injector, is often the first line of treatment for anaphylaxis. EMTs must review and master EpiPen administration, including proper injection sites, timing for repeat doses if necessary, and recognizing when it is appropriate to assist a patient with their own device. Additionally, EMS management involves maintaining a patent airway, providing high-flow oxygen, monitoring vital signs, and preparing for potential cardiac arrest if airway obstruction worsens. Rapid transport to the hospital is essential, as further treatment, such as advanced airway management or intravenous medications, may be needed. Continuous reassessment during transport is critical to detecting any changes in the patient's condition. Proper communication with medical control and thorough documentation of the event also play vital roles. Early recognition, prompt administration of epinephrine, and aggressive supportive care can be life-saving. EMS providers must stay knowledgeable and ready to intervene immediately to improve outcomes in allergic emergencies. Allergic reactions occur when the body's immune system overreacts to a substance that it mistakenly identifies as harmful. Normally, the immune system helps protect us from infections and disease. However, in an allergic reaction, it responds too aggressively to things like certain foods, insect stings, medications, or environmental triggers like pollen. This overreaction can vary widely in severity. In some cases, it may present as mild symptoms such as a rash, hives, sneezing, or watery eyes. These mild allergic responses, while uncomfortable, are generally not life-threatening and can often be treated with basic interventions like antihistamines. However, allergic reactions can also escalate into something much more dangerous: anaphylaxis. Anaphylaxis is a severe, life-threatening allergic response that can develop rapidly and requires immediate medical intervention. It often involves airway swelling, difficulty breathing, a sudden drop in blood pressure, and even shock. In the field, recognizing the difference between a mild allergic reaction and anaphylaxis is critical. The sooner we identify the severity, the faster we can initiate life-saving treatment like administering an epinephrine auto-injector and providing high-flow oxygen. Remember, even if a patient initially presents with mild symptoms, allergic reactions can worsen quickly. Always reassess frequently and be prepared to act. Early recognition, swift treatment, and rapid transport to definitive care can mean the difference between a positive outcome and a tragic one. Understanding this spectrum of allergic reactions is key to providing excellent, life-saving pre-hospital care. When we talk about allergic reactions, it's important to understand some of the most common triggers we might encounter in the field. Foods are one of the leading causes, with items like nuts and shellfish being among the most common offenders. These allergens can cause anything from mild rashes to severe, life-threatening anaphylaxis. Another major category to be aware of is medications, particularly antibiotics such as penicillin, which can trigger sudden allergic responses even in patients with no previous history. Insect stings are another frequent cause we see, especially during the warmer months. Bees, wasps, and hornets can inject venom that provokes a severe allergic reaction in some individuals, leading to swelling, airway compromise, and shock. Finally, latex allergies are important to recognize. Latex is commonly found in gloves and medical equipment, and some patients, especially healthcare workers or individuals with frequent medical exposure, may develop a severe allergic response after contact. Recognizing these common allergens is crucial because it allows us to anticipate and act quickly when patients present with early signs of a reaction. Always ask about any known allergies during your assessment and be prepared to intervene rapidly if symptoms develop. Early identification of the allergen can also help hospital staff provide more targeted treatment once you arrive at the emergency department. Keeping these triggers in mind during every patient encounter helps ensure you're ready to deliver the best possible care. Mild allergic reactions often present with signs and symptoms that can easily be overlooked if we're not paying close attention. One of the most common indicators as seen in this picture is the appearance of hives or a rash on the skin. These are usually red, raised, and very itchy, and they can appear suddenly after exposure to an allergen. Another frequent symptom is itchy, watery eyes, which can be mistaken for simple irritation or seasonal allergies but may actually signal the beginning of a more serious reaction. Nasal congestion is another important sign to watch for. If a patient suddenly develops a stuffy nose along with other symptoms, especially after exposure to a known allergen, it could be part of an allergic response. Localized swelling is also common, especially around the face, lips, tongue, or at the site of an insect sting or injection. While these symptoms may seem minor at first, they can rapidly progress to more severe airway compromise or full anaphylaxis. As EMS providers, it's critical to recognize these early warning signs during your assessment. Don't dismiss them, even if the patient seems stable at first. Early identification allows for faster intervention and better patient outcomes. Always maintain a high index of suspicion, ask targeted questions about recent exposures, and closely monitor the patient for any signs of worsening respiratory or circulatory status. In allergic emergencies, small symptoms can be the first warning of a much larger problem. When managing a patient with a suspected allergic reaction, the first priority is always the ABCs: airway, breathing, and circulation. These core components must be assessed and supported immediately, as allergic reactions, especially anaphylaxis, can quickly compromise any of them. Airway swelling or respiratory distress requires immediate attention to prevent complete obstruction. After checking ABCs, it's important to look for medical alert jewelry. Bracelets, necklaces, or wallet cards can quickly give you critical information about a patient's known allergies or medical history, even if they are unconscious or unable to communicate clearly. Identifying the exposure history is another key step. Asking questions like, "What were you doing when the symptoms started?" or "Did you eat or touch anything new?" can help pinpoint the allergen and guide further treatment. In some cases, the patient may not know what triggered their reaction, so stay alert for environmental clues such as insect activity, foods, or medications nearby. Continuous monitoring of vital signs is essential during allergic reactions. Watch for changes in breathing, pulse, blood pressure, and skin signs that might indicate worsening condition. Because allergic reactions can escalate rapidly, ongoing reassessment ensures you are ready to respond if the patient's status deteriorates. Early intervention saves lives, and careful, systematic assessment sets the foundation for excellent patient care in these critical moments. Always treat allergic reactions with urgency, even if the symptoms seem mild initially, because deterioration can happen without warning. When managing a patient experiencing an allergic reaction or suspected anaphylaxis, the first step is always to ensure scene safety. Make sure the environment is safe for both you and the patient before initiating care. Once the scene is secure, perform a rapid patient assessment focusing on the ABCs: airway, breathing, and circulation, as these can quickly become compromised during a severe allergic reaction. Administer high-flow oxygen as needed to maintain adequate oxygenation, especially if there are signs of respiratory distress or hypoxia. If indicated by patient presentation and local protocol, administer intramuscular epinephrine, IM, or assist the patient with their prescribed EpiPen. Early epinephrine administration is critical in reversing the life-threatening effects of anaphylaxis. After medication is administered, continue to monitor the airway closely for any signs of swelling, obstruction, or further compromise. Frequent reassessments are essential, as the patient's condition can change rapidly. By following these steps systematically, EMS providers can effectively stabilize the patient and improve the chances of a positive outcome during an allergic emergency. After initial management of an allergic reaction or anaphylaxis, preparing for rapid transport is essential. Time is critical, and definitive care at the hospital may be necessary even if the patient initially appears stable. During transport, it's important to continuously reassess the patient's vital signs, watching for any changes that could indicate deterioration. Allergic reactions, especially anaphylaxis, can worsen suddenly even after treatment, so frequent reassessment allows you to catch early warning signs of airway compromise or circulatory collapse. Additionally, EMS providers must always be prepared to perform CPR if the patient's respiratory distress progresses to complete airway obstruction and cardiac arrest. Having airway equipment, suction devices, and resuscitation supplies immediately available during transport can make the difference between life and death. By staying alert, reassessing often, and preparing for the worst-case scenario, EMS crews can deliver the high-quality care necessary to give these patients the best possible outcome. When deciding whether to assist with or administer an EpiPen auto-injector, EMS providers should first assess for clear signs of airway compromise, respiratory distress, or signs of shock. These critical symptoms indicate a severe allergic reaction or anaphylaxis, which requires immediate intervention. If the patient has a prescribed EpiPen auto-injector available, and they are showing these signs, it is appropriate to assist them in using their device according to local protocols. EpiPens are available in pediatric and adult dosage. Adult doses or 0.3 mg have a yellow label and yellow carrier cap, while the pediatric dose or 0.15 mg has a green label and a green carrier cap. Always confirm the medication and check the expiration date before administration. In situations where the patient is unconscious and unable to self-administer, EMS personnel must follow their agency's protocols carefully, which may allow for provider administration of the EpiPen. Early recognition and rapid treatment of anaphylaxis are key to preventing airway obstruction, cardiovascular collapse, and death. As always, continuous reassessment is vital after administration to monitor for improvement or deterioration. If the patient is in anaphylaxis, you give the EpiPen, even if they have heart disease, are elderly, pregnant, or on beta blockers. The risk of not giving it is much worse than any side effects. When administering an EpiPen, it is critical to follow a clear, step-by-step process to ensure the medication is delivered safely and effectively. Begin by removing the safety cap from the device, exposing the needle end. Before proceeding, always verify that the EpiPen has not expired. An expired device may not deliver the proper dose or may be ineffective. Check the viewing window to confirm that the fluid inside is clear and free of discoloration or particles. Cloudy or discolored fluid could indicate that the epinephrine has degraded and should not be used if another option is available. Once the device is prepared, firmly press the tip of the EpiPen against the patient's outer thigh, midway between the hip and knee. It is designed to be administered through clothing if necessary. Apply firm pressure until you hear or feel a distinct click, which indicates that the needle has deployed and the medication is being delivered. Hold the device in place for several seconds, usually around 3 to 5 seconds, depending on manufacturer instructions, to ensure the full dose is administered. After removing the EpiPen, Massage the injection site gently for about 10 seconds to help improve absorption of the medication into the muscle. After use, place the used EpiPen into a sharps container if available, and continue to monitor the patient closely for any changes in their airway, breathing, or circulation, as symptoms can return or worsen rapidly. Recognizing when to administer epinephrine IM is a critical skill for EMS providers. AP administration IM is indicated when a patient shows signs of airway compromise, respiratory distress, or symptoms of shock, all of which suggest a severe allergic reaction or anaphylaxis. It's extremely important to remember that epinephrine for allergic reactions must be given intramuscularly, IM, not intravenously, 4. For epinephrine is reserved for cardiac arrest or other specific advanced life support situations and carries a much higher risk of complications if misused. Always follow local protocols regarding adult and pediatric dosages, as the amount can vary based on patient size, age, and medical guidelines. For adults, the typical dose is 0.3 mg IM, and for pediatric patients, it is usually 0.15 mg IM. The preferred administration site is the upper thigh, specifically the vastus lateralis muscle, because it provides the best absorption and fastest onset of action. Delivering the medication into the upper thigh, even through clothing if necessary, ensures the patient gets the full benefit of the medication quickly. Always reassess the patient frequently after administration, as a second dose may be required if symptoms persist or worsen. Fast, correct administration of epinephrine can be life-saving, and being confident in the proper technique is essential for every EMS professional. Before administering epinephrine in an emergency, it's crucial to ensure the medication is safe and effective. Begin by checking the expiration date printed on the vial or auto-injector. Expired medication may not provide the desired effect, especially during life-threatening anaphylaxis. Next, inspect the solution. Epinephrine should be clear. If it appears cloudy, discolored, or contains particles, it must not be used. Administering compromised medication can worsen the patient's condition or render the treatment ineffective. Accurate dosing is essential and must follow your agency's local protocols. For adults, the typical intramuscular IM dose of 1:1,000 epinephrine is between 0.3 mg. This is usually delivered into the outer thigh for rapid absorption. Pediatric dosing, however, is 0.15. Always administer epinephrine intramuscularly, never intravenously, when treating anaphylaxis unless otherwise directed by medical control. After administration, continue to monitor the patient's vital signs and be prepared to repeat the dose per protocol if symptoms persist. Teaching moments during training should include hands-on practice with trainer devices and reviewing local guidelines regularly. Understanding these steps ensures EMS providers can deliver life-saving care swiftly and safely in critical situations. Would you like me to create a downloadable version of this as a teaching handout? When administering epinephrine intramuscularly, proper technique is essential to ensure the medication is delivered effectively. First, select the appropriate injection site, the mid-outer thigh, specifically the vastus lateralis muscle. This site is preferred due to its accessibility and rich blood supply, which promotes rapid absorption. Once the site is chosen, clean it thoroughly using an alcohol prep pad to reduce the risk of infection. Administer the injection at a 90-degree angle, inserting the needle straight into the muscle. In emergency situations, it is acceptable to inject through clothing if time or conditions do not allow for direct skin access. After the medication has been delivered, gently massage the injection site. This helps disperse the drug into the muscle tissue and enhances absorption. Finally, ensure that the syringe or auto-injector is disposed of properly in a designated sharps container to prevent injury or contamination. EMS providers should practice these steps regularly to build muscle memory and ensure confident performance during critical moments. After administering epinephrine, continued patient care is critical to ensure a positive outcome. First, closely monitor the patient's airway and breathing. Although epinephrine can relieve airway swelling and improve respiratory function, symptoms may recur or worsen, especially in severe anaphylaxis. After administering epinephrine, it is important to closely monitor the patient's heart rate and overall cardiovascular status. Epinephrine is a potent sympathomimetic agent, and one of its expected side effects is an increase in heart rate, tachycardia. While this response is normal and often beneficial in counteracting the effects of anaphylaxis, it is essential to observe for excessively high heart rates that could potentially lead to complications, especially in patients with underlying cardiac conditions. Be vigilant for any signs of deterioration. Prepare to administer a second dose if symptoms persist or return. This decision should always be guided by your local medical protocols. Do not delay transport. Initiate rapid movement toward the nearest appropriate hospital. Time is essential in anaphylaxis management, and early hospital intervention can provide additional treatments like antihistamines, corticosteroids, or advanced airway support. While en route, notify the receiving facility that epinephrine was administered. This communication helps the hospital prepare for continued care and ensures the patient's treatment history is known upon arrival. EMS providers play a vital role not only in the immediate intervention but also in ensuring a seamless transition of care through prompt and thorough communication. When treating anaphylaxis, it's important to recognize that pediatric patients require different epinephrine dosages than adults. Pediatric EpiPens are specially designed to deliver a smaller, appropriate dose for children, typically 0.15 mg compared to the 0.3 mg standard adult dose. Always verify the correct device based on the patient's weight and age before administration. After giving epinephrine, regardless of the patient's response, patients must be transported to a hospital for further evaluation. Epinephrine often temporarily improves symptoms, but it does not eliminate the underlying allergic reaction. One critical reason for mandatory transport is the risk of rebound anaphylaxis, where symptoms can return after an initial improvement, sometimes even hours later. This secondary reaction can be just as severe, if not worse, than the original event. Teaching providers to recognize these risks emphasizes the importance of monitoring patients post-epinephrine and ensuring they receive full medical evaluation and treatment beyond the pre-hospital setting. Early recognition and prompt treatment of anaphylaxis are critical to saving lives. Anaphylaxis can progress rapidly, and delays in intervention can lead to airway obstruction, cardiovascular collapse, and death. EMS providers must be trained to identify the early signs, such as difficulty breathing, hives, swelling, or hypotension, and act without hesitation. The administration of epinephrine, whether by EpiPen or drawn up from a vial, is the first-line treatment and can be truly life-saving. Epinephrine works by reversing airway constriction, boosting blood pressure, and counteracting the severe allergic reaction at multiple levels. However, giving the medication is only the beginning. Continuous monitoring of the patient's airway, breathing, and circulation is essential after administration to detect any changes or recurrence of symptoms. Rapid transport to an appropriate medical facility remains a cornerstone of care, ensuring the patient receives additional treatments and prolonged observation, as anaphylaxis can relapse even after initial stabilization. Teaching EMS personnel these core principles reinforces their vital role in managing one of the most time-sensitive emergencies in the pre-hospital setting. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your knowledge of the topic. And thank you for visiting easyemsceu.com.